If you've been lying awake night after night, frustrated, exhausted, and wondering, why can't I sleep like I used to? You are certainly not alone. Sleep disturbances during perimenopause and menopause are incredibly common and can happen in up to 60% of women. And honestly, they are not your fault. This is a time of hormonal transition, and when your body is shifting, your brain is also adapting. And so yes, your sleep may be affected as well. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert with over 11 years of experience in helping women just like you improve their sleep quality as well as your overall health and well-being. So today, let's talk about how to gently support yourself through this insomnia period without any shame and with a lot of deep self-compassion. Step number 1. All right, ladies, stop fighting sleep and learn to be kind to yourself. The truth is, the harder you try to sleep, the more anxious you may begin to feel, and then the more elusive sleep becomes. Sleep is a passive and natural process that happens within our brain and our bodies at night when we allow ourselves to relax, and our brain waves will then slow down. If you find yourself wide awake at 2 or 3 a.m., perhaps place a hand over your heart and say to yourself, this is uncomfortable, and yet I'm still doing my best. My body is going through something big, and I'm going to be okay. This is an act of self-compassion. It may feel fluffy, but it's actually backed by science. Studies show that when we treat ourselves with kindness, our cortisol levels actually do drop, and our nervous system feels calm. And it makes sleep more accessible to us and even inevitable. So start with this mantra. Tonight I will rest. Even if sleep doesn't come, I will still rest. Step number 2. Honor the role that your hormones play. Ladies, you are not broken. During perimenopause, hormones like estrogen and progesterone do fluctuate, and that can affect the way your sleep architecture works, namely your sleep stages. You may find yourself waking up more frequently, sleeping more lightly, or finding it really hard to go back to sleep after a couple hours of sleep. Guess what? This is normal, and it doesn't mean you're doing anything wrong or that you're failing or that you're a horrible sleeper. You may also notice some things like night sweats or even early morning awakenings, racing or ruminating thoughts. All of these things that you're experiencing are connected, and understanding this can help you release some of that harsh inner dialogue. Remember, your body is not broken, it's just in a transitionary period. It's a season of life, and sometimes these seasons can take time. And remember to love yourself through it. Step number 3 is to create a compassionate wind down ritual. Now let's create space for sleep to arrive. Not forcefully, but with warm invitation. As much as you can, reserve the last hour of the day just for you. So about an hour before bedtime, create this ritual. Maybe dim the lights, step away from any screens, do something nourishing for your body, your soul, and your mind. Perhaps it's a gentle warm bath, some stretching, or some journaling about the day, or whatever you're going through. Creating a ritual that says to your body, you're safe, and it's time to let go of the day. Now, what do you do if anxiety starts to creep in? Consider this mantra. This moment is temporary, and I choose calm over control. Step number 4. If you really can't sleep, be as gentle as possible and perhaps redirect your thoughts, your body, or your emotion. So if you've been lying in bed for a half an hour or more and you're still wide awake, consider the scale as a mental check-in. Ask yourself, how annoyed am I right now? If it's a pretty low level, okay, maybe just stay in bed. If it's a medium level, wait it out a few minutes. And if it's a super high level where you're frustrated, you're tossing and turning, you're getting angry, just get out of bed. The purpose for this is to avoid associating any distress or negative thoughts or feelings or emotions with your bed. Well, what can you do? Try going into a cozy chair, read a calming book, maybe sip on some herbal tea or listen to a guided meditation. Now, once your body feels drowsy again, return to your bed. This practice can teach your brain that the bed is a place for sleep, not a place to wrestle with your negative or unhelpful thoughts in and around sleep. Step number 5 is to understand that sleep is a process and you are not alone in having insomnia during perimenopause. Note that sleep may not return overnight, but with consistent care, kindness, self-compassion, and the right support, I know it'll return. And I've seen this in thousands and thousands of women. You may also want to talk with your doctor or your nurse practitioner about tools that may help you support sleep during perimenopause, which may include things like natural supplements or something called cognitive behavioral therapy for insomnia, or even hormonal replacement therapy or menopausal therapy if that's appropriate for you. Whatever path you do choose, let it be rooted in your own healing journey, not in self-judgment or feel like you're giving up or you're not strong enough to muster through this. Going through perimenopause is one of the most powerful seasons of your life, and you deserve the rest. You deserve compassion and to wake up feeling rested, refreshed, and ready for the day ahead. I'm Dr. Val, and I'm here to remind you ladies that sleep may feel pretty far away right now, but your body has this inner wisdom and it knows how to rest. Trust it, be kind to yourself, and don't forget that you are not alone. Thanks for watching, ladies. Until next time, sleep well. And if you want to learn more about sleep health and whole living, check out our other videos.